It's the AEMT lecture series. Welcome back. Glad to have you. So I'm going to redo the video lecture for Chapter 7, and I'll tell you why. Because I was reviewing the National AEMT curriculum, and when I was going through there, I noticed that a lot of what you learned in basic EMT school is going to apply here and will be testable information for you once you take registry, meaning you could see a lot of the same questions that you saw your first time. And so we need to refresh. The other reason is some of you guys may have not had me as your instructor, or maybe you haven't been through EMT school in a while. I'm sure if you'd had another instructor in the past, 5 years, probably be okay. But you're still going to need to be refreshed on the information. And so what I want to do is look over A&P from what you should already have a base knowledge of, and then kind of build on that. So that's the plan. That's kind of what we're going to do with this video lecture. So let's talk about it. Let's look at anatomy and physiology, and what I'd like to start start with doing. What I'd like to start with doing is introducing the organ systems to you again. So let's do that. We're going to start off by the cell, right? I've said it in previous videos. You need to know what the cost is. So when we say cellular death, you need to understand that if enough of those cells die, then we're going to start affecting tissue, and then organs and organ systems, and then it's a cascading effect straight to death. So we need to be able to recognize that, and we need to see that for what it is. So skeletal system, 206 bones. Function is to protect those organs, so that that they stay protected inside the cavity. They're all, the skeletal system does quite a bit. We'll get to that in just a second, because we're going to talk about the bones and how they also provide protection, but they also provide in the bone marrow, we have red blood cells, white blood cells, so they also play a role in infection fighting too. Then we have your integumentary system, your body's largest organ system, your skin, and it, all of these organ systems. I want to say it, it's important. It's important. They're all very important. The role of the system, though, is one. It's an infection fighter. If a virus or bacteria lands on your skin, it's designed so that your pH will be there and can actually, kill that bacteria or virus just from your pH. Now, if your skin's not intact, you have an opening. That's how these germs and pathogens get in. It regulates body temperature, so you'll see burn patients who have had an injury to their skin. Okay, so they are very hypothermic, and they fight that, and it's a problem for them if there's enough surface area that's burned. And then, of course, it's a way for us to eliminate waste, through sweating. the muscular system, right? The three main parts of this that you got to know that we'll get into, but you have to be able to recognize the difference between skeletal muscle and smooth muscle. And then there's cardiac muscle. So, skeletal, obviously voluntary type control. If we decide to pick up a cup of coffee or pick up anything else that you have to get through this lecture, that's going to be voluntary and comes from your skeletal system. But then we have smooth muscle found in your vessels, and also in your respiratory tract and your bronchioles. The body has a way to vasoconstrict or vasodilate those muscles. And, obviously that's non-voluntary because we can't control that. And we can't control cardiac muscle. We can't stop our heart from beating. The nervous system, again, here we go. It's the big signaler, right? And I think about those old World War II movies where you had the signalman on the ship out there in the ocean, and they're flashing lights, in like a Morse code to other ships to signal. And your nervous system is that it's going to send a message from the CNS to the PNS, to your peripheral nervous system, on what to do. But the PNS also sends information, data to the CNS so that it can know what to do. It takes that information, processes that, and decides what's the best course of action. The endocrine system, here you have your type of infection fighting system, okay? But most importantly, it's I was thinking of the lymph nodes, so forgive me on that. Endocrine system, we're talking about, this is how cells communicate, right? So this is how cells talk to one another. This is how organ systems talk to one another through chemical and hormones. Those cells have receptors that receive hormones, chemicals that are captured onto the cell, and if it's the right hormone, it'll allow that information to come in. The cardiovascular system, all right, this is your circulatory system, and this is how blood and nutrients get around, right? And remember, it's your plasma that's the actual carrier, right? It's like the car. And then you have your red blood cells, white blood cells, platelets that actually ride in the car. And so that's how you can be dehydrated after vomiting and and be in hypovolemic shock, because you still have all your whole blood there. You just don't have a way to get it to where it needs to go, because plasma is mostly water, and if you sweat, fever, nausea, vomiting, that's what you're losing. This is what I was talking about earlier, your lymphatic system. All right, this is an infection fighting type system, and it makes and moves something called lymph. You've heard of lymph nodes, okay? It's a clear fluid. It contains white blood cells, okay? And some of the organs involved in this are your tonsils, your adenoids, your spleen, your thymus. Then we have the respiratory system, and the goal of the job of the respiratory system is ventilation and oxygenation, right? It's bringing in O2 and getting rid of CO2. We'll talk about acid base. This is a big player in acid base, and it serves as a buffer, right? And we'll get into that later, to maintain a normal acid base balance. Digestive system. All right, so this is the job of the digestive system is to break down food, right? It's going to absorb those nutrients, it's going to get those carbohydrates and move them around to where they need to go so that they can be in the game. Some of the players here is your mouth, esophagus, your stomach, small and large intestines. Okay, so. And then you have your urinary system, another big player in the acid-base system. Okay, it's going to eliminate waste. We'll learn that it's going to actually be able to get rid of acid, but it's also can, if it needs to, it can also try to hold on to the bicarb that our blood makes. So we'll get into that here in a little while. The reproductive system, right? So male-female reproductive systems, and they're important for obvious reasons, but they're important to us in the pre-hospital care setting, because if there's injuries there or if there's illness there and we don't recognize it and we don't do anything about it, we could actually ruin someone's chances to reproduce. Your immune system, so our white blood cells, right? This is what goes to fight bacteria and viral type pathogens, infections. All right, and then we get to the definitions of anatomy and physiology. Anatomy is kind of like, where is it? Where's it found? And physiology is how does it work? How does it work with other systems, etc. All right, so I'm not going to spend a lot of time on the anatomical positions. One, for a couple of reasons. One, I can't really teach you anything there. It's all memorization, right? You're going to have to be able to memorize those positions: left lateral recumbent, right lateral recumbent, supine, and all that. Fowler's position, etc. So we got to, surely by now we know a lot of these. What I try to do is, try to use them when I'm documenting. If I'll talk about, something being found more medial or more lateral, proximal, distal to something, because if you use it, you won't lose it. And so I try to use it when I can. I mean, I don't get crazy with it, but at the same time, every now and then it's actually helpful, for me to be able to, if I'm trying to explain something, to be able to use some of these. When it comes down to the quadrants, we're back in the game. Some of you been out longer than others, but we're back in. We're on the front lines of learning, and you can bet that you will be tested on organ systems and where they're at. And we use the abdominal quadrants. Right upper quadrant, left upper quadrant, etc., to be able to describe where these are at. And you can bet that they're going to ask you, what major organs found in the right upper quadrant and left upper quadrant. Well, the liver. Obviously there we can see that we can see that in this depiction as well, right here. Liver's right upper quadrant here, but also sneaks over the line and is found in left upper quadrant. They may ask you, the liver's located in the right and left upper quadrant, but the majority of that organ's found in what quadrant? Well, you would obviously be able to say the right upper quadrant. So just getting you ready, getting you to anticipate some of the questions, and when you're studying, that's how you study. Not just do I know that the liver is in the right upper quadrant and left upper quadrant, but it's good to understand that the largest majority of the liver is in the right upper quadrant. Let's see here. Let me continue. Just more pictures of that, more pictures of that. The muscular system. Okay. The musculoskeletal system. Muscles, bones, tendons, ligaments, right? The skeletal system, though, when we're talking about it, we need to understand, like the skull, for instance. They may give you a scenario, you have 42-year-old male involved in a motor vehicle collision, suffered blunt head trauma. Patient's behavior is very erratic, very aggressive, etc. What component of the skull would you what you think is injured, and that would obviously be up here the frontal lobe, because that's what controls that. So we need to know where the frontal lobe is. We need to know mastoid process, maxilla, mandible, all of that stuff. It's good to know. Sometimes even if you know it's there, you have to know a little more about what goes on there. And your spinal column, it's 7 cervical vertebrae. Know these numbers: 7, 12, 5, 5, and 4. Excuse me. So yeah, you're gonna have to rememorize that maybe. It's been a little while for some of you. And here we have the pelvis. So you have the pelvis girdle. And when we're talking about the pelvis, a good question there would be, patient presents with a left hip fracture. Which bone in this would not be one that would possibly be fractured, right? And so they may give you, your sacral, your sacral hiatus, your coccyx, and then they may throw in there something like a fibia. Well, obviously the fibia is part of the leg. Degenerative disc disease, right? We need to know that it's that breakdown of that pad in between the vertebrae. That's the disc, right? And the function of that is to provide that cushion for the bone. And when that disc starts breaking down because of age, that gets you your degenerative. Your thorax. So, how many pairs of ribs are there? Well, there's 12 pairs of ribs that connect to the 12 thoracic vertebrae. How many in your rib cage? How many ribs connect to the thoracic vertebrae, etc., right? What's the function, right? It's protection. And then, but like I said, a little more about it. Not just organ system protection, because it does that, but to what organs? Your heart and your lungs and your abdominal organs. Again, here's your pelvis. We talked about that a minute ago. They could give you, they could say the following, your ilium, your pubis, your ischium, and then, your patella. Obviously, your patella would not be part of a hip fracture. And then we go into the lower extremities. We talk about the upper extremities. It's just like, again, memorizing and understanding where these are at. That there's 8 bones that consist of the carpals. And joints, man, I cannot stand joints. I know it seems strange, but I hate learning joints. I don't know. It's a mental thing with me, I guess. I know what they do, but to understand that this one is abduction, this one's adduction, pronation, supination. I don't know. I just one of those things. I should probably work on that, but it is what it is, I guess. Ball and socket joint. Okay, more joints. I was talking about this earlier on your types of muscles, right? So we have skeletal muscle. Erase this real quick. And we talked about skeletal muscle before, and it's voluntary, right? We talked about the cardiac muscle, but there's a couple things about the cardiac muscle that you must know. It has its own blood supply, and it has its own electrical system. So the heart contracts through its own electrical system, and that electrical system is brought on by, remember we said cells communicate through chemicals, okay? In this sense, they're going to communicate through sodium and potassium. And if the electrical system is messed up, the heart muscle can be strong and healthy. But if you got a problem with that electrical system, a strong heart muscle can die. All right, so I mean, like, so let's say you have potassium, and let's say it's either, and this is one you just can't mess around with, if it's elevated or if it's not elevated, if it's, if you're missing some, right? That could be a major issue. We had a guy come in the other day. He was like 55, I think, and he went into cardiac arrest at a bowling alley. And of all places for an AED to be, there happened to be one there. Bystanders put the AED on him. It recommended a shock. It delivered a shock and converted him. So here we were waiting for EMS to come in. And I'm thinking, yeah, this is going to be a STEMI, and we're going to be dealing with a post-cardiac arrest patient. I'm ready to go to work. And this guy rolls in the door. He's conscious. He's alert. His 12 lead didn't look that bad. We drew labs and found out that his potassium was very low. So we fixed that pretty quick. We started giving him potassium, and he was admitted, I'm sure, made a full recovery, and went home. So heart muscle's fine. His heart muscle's good. It got shocked, but no big deal there. And it was out of the worst case scenario, that was the best for him. And then we have smooth muscle. It's really important to understand where it's at. Well, smooth muscle is found in your organs. Okay, and it's found in your vessels. This is what the vessels do to vasoconstrict. This is what these guys do to vasodilate. You can't control that. That is smooth muscle. Same thing for your lungs and your bronchioles. Bronchioles can constrict like an asthma attack. If we treat it appropriately with some albuterol, we'll get that bronchial dilation, and then life is good. All right, sorry about that. I am back. Excuse me, I had to pause you guys there for a second for a little lengthy amount of time. So coming back to the video a little bit, kind of trying to figure out where we're at. But again, I think we talked about the smooth muscle. Yeah, we did. We finished up talking about that. I think we're ready to go to the next slide. Let's see here. Sorry about that. All right. This is just the next couple of slides just to explain what I've already explained about the skeletal muscles and all about the smooth muscles. Let's talk about vasodilation here for a second, and vasoconstriction. I think we all should feel pretty good about that right now. Let's see, I'm sorry. Trying to fix my computer here. I probably should have not unpaused you guys or came back till I was completely ready, but why is it doing that? All right, anyway. Vasoconstriction, vasodilation, I think we can remember about that. We remember that the vasoconstriction, smooth muscles are constricting, and vasodilation, of course, is when they are becoming larger. Moving right along. Cardiac muscle, we talked about it. Automaticity, remember, that's just saying that those cells are there and they are ready for, ready to be charged. Well, not kind of bad example. They're bad to kind of say it that way. There are cells that already are automated to be charged. Maybe I should say it like that. The respiratory system, here we go. Now we can get to cooking here in a little bit. When we talk about the respiratory system, we need to understand that the function is to provide oxygen, right, to the body cells, and to also remove waste, the waste products like CO2. So that is the function of the respiratory system. Here we go. We're still talking about the process of moving oxygen, CO2, across that cellular membrane. Remember that? We'll hit that here in a second. In and out of the alveoli, the capillaries. Okay. So gas exchange, we will review that and make sure that you're good there, because that's a big deal. It's a big deal. All right, let's see here. Righty. So what are we looking at? What we're looking at here is the bronchial. Okay, and remember, it goes from bronchi to bronchioles. Bronchi to bronchioli. Man, why am I having a stroke or something? Bronchi, bronchioli. Okay. So that's what we're looking at here. We've got our capillary bed right here. And remember, that's where all your blood vessels get really small. Your arteries become arterioles, veins become venules, and they get really small. And they get small so they can make that gas exchange. It's right here. What we're looking at is an alveoli sac, and that's opened up so that we can see what's inside. So what we're looking at is if I took a knife and just kind of sliced it around like this, if we just cut that part open, we will be looking at that. All right. So what we have here is the pulmonary venule, okay, which is the same as a pulmonary vein. It's just a small part. We have the pulmonary arteriole, which is the same as pulmonary artery, just got small, right? And so what we know is, we know that blood comes in through the right ventricle. Change my pen color real quick here. I need a different color. All right, so right ventricle, we know that it's going to go through the tricuspid valve. Golly. Did you hear me? I can't believe I just said right ventricle. Blood is going to come in to the right atrium through the tricuspid valve into the right ventricle, and from the right ventricle through the pulmonic valve and into the what? At this point, you probably think I'm asking you, but no, it's a pulmonary artery. Okay, so the pulmonary artery right here, blood's going to come in, and what's significant about this blood, all right, is that it needs to come over here and drop off CO2, right? Because it's coming from the body, right? So we are coming from the body. We've already picked up CO2. We've dropped off here to the cells. We've dropped off the O2. Okay, so, and we know that this blood here, unoxygenated blood's coming here. And so what's going to happen at this capillary bed? Well, what's going to happen is we're going to drop off this CO2. All right, it's going to go into the alveoli. And why is it going to go there? It's because there's far less concentration of CO2 here. And O2, which is here, is going to come up. Why? Because there's more CO2 up here than there is O2. And that's called diffusion, right? That's diffusing. And diffusion like that is like it's costs no energy. It's like water running down the hill. Okay, that's exactly what it's about. The CO2 is going to diffuse into these alveolar sacs, so that because there's very little CO2 there, we're going from a greater amount to a less amount. Okay, so O2 comes up, and now that we've made the exchange, this is a pulmonary venule, or aka pulmonary vein, and it's going to fly back over to the left atrium. Okay, and then from the left atrium, we're going to go into the bicuspid valve, into the left ventricle, and out the aortic valve into the aorta, where blood then is going to go out to the body. But we have to understand that process, and we have to be very clear on how that process works, because we're going to add to that an A a little bit. You have to understand that part before you can understand acid base. Okay. The respiratory system's functions, we've already talked about it, except, let's see here real quick. I don't know. One thing that's really got me like flustered here is my eraser's not working like the way it's supposed to work. Like I have it set up to where I only have to hit one button and I can go straight to my eraser, and now it's like not working that way. All right, I'm back. So let's see. We wanted to talk about oxygen molecules move from across the membrane from an area of higher concentration, right, to that area of lower concentration, and we said that was called diffusion, right? That's diffusion. Higher concentration to an area of lower concentration. Think about it like this. If you don't know this and you're struggling with it, I hope you're not, but if you are, it's okay. All right, so think about it like this. Think about like if we're dropping off O2, okay, and we have CO2 here that needs to go up. All right, and so this would be like the cell. All right, this is the O2 is being delivered, and CO2, we're going to pick it up. You could think about it like a magnet. Right? It just draws it. Okay? And there's a magnet here that just draws it. However you need to look at it, it's fine. But from a higher concentration to a lower concentration. So this is the mechanical part of the respiratory system, right? The upper airway, and so you have to kind of know it in this order, because they'll probably ask you in the following order, you know. And so what you want is you're gonna have your air's gonna come in through the mouth, or even through the nasal cavity. Right, it's going to end up in the pharynx, which is just the throat, right? Back of the throat. Then it's going to enter the trachea, and then from the trachea to the bronchi, and then from the bronchi to the alveoli. So what we have here is like, I don't know, to me, I remember being a student, and if I could see something, then I would struggle with it. And when we're talking about oxygenated blood and unoxygenated blood, we talk about it coming from the heart into the lungs. And to me, you know, that was two different systems, and I would imagine it in two different ways. But here what we have, okay, so if you can look at it like maybe like this, here's your right atrium, your right ventricle, your left ventricle, and your left atrium, right? All right. And so what you have here, here's your aortic arch. So we know blood is coming out of here that will be oxygenated, and it goes to the body. Okay. But here we have the pulmonary artery. So we know then that when this blood is pumped up through this pulmonary artery, it gets pumped out. And right here's your bronchioles. Okay. And so here's your pulmonary artery. Right down here is what we were just looking at. That's the capillary bed. Okay. That's where gas exchange is taking place. And remember, we said it comes, the blood comes in deoxygenated through that pulmonary artery. How does it go back? How does it get back to the left ventricle so that it can be pumped out? So it's going to go back through the pulmonary vein. Here's your pulmonary vein right here. Okay. Pulmonary vein is going to go back. Okay. And it's going to cut through, and bam, it's going to deliver that blood back to the left atrium. Right. It's oxygenated blood now. It's going to go from the left atrium through the bicuspid valve, left ventricle, aortic valve, and bam, out to the body. But this lets you kind of see everything as one, as a whole. So maybe that helps you if you're struggling with this. All right, so ventilation, the true definition is that it's a mechanical process. Okay, it's a mechanical process of how air is moved into and out of the lungs. So when we talk about ventilation, then we talk about a mechanical process. That's like something mechanical on your car, like the carburetor. A good example for us would be the diaphragm. Right, so it's a mechanical process. Ventilation is not gas exchange. So respiration is not gas exchange. It's part of it, but it's not all of it. So then we look at the airway. Our airway is divided into upper airway and your lower airway. It's the dividing point is the larynx. So anything below the larynx is going to be considered your lower airway. Okay, so we have to understand all the concepts here. So if I have usually an upper airway obstruction, it's above the larynx. Okay, and so anything obstructed in the airway below the larynx is a lower airway obstruction. So examples. Like if I'm choking on food, it's a good chance it's an upper airway obstruction. A lower airway obstruction could be, asthmatic. That's an obstructed bronchioles. And that's a picture of the epiglottis. That's the vocal cords. Okay, we have just another picture here of the trachea. It branches into the two bronchi, right and left bronchi.